The purpose of this video today is to give you the understanding of what hyperbaric oxygen is, how it works, what possible side effects or dangers could be involved. Hyperbaric oxygen therapy is basically oxygen and pressure. So it's administering oxygen under pressure. We live at sea level and we breathe air. Air is 21% oxygen. Each of our red blood cells contains 4 molecules of hemoglobin, and that hemoglobin is very good at giving up CO2 and picking up the oxygen in our lungs. Most of the time, we have 97 or more % of our hemoglobin saturated with oxygen when it leaves the lungs. If I brought an oxygen tank in here now and gave you oxygen, 100% oxygen at sea level, you would get more oxygen in your lungs, and you would likely 100% saturate your hemoglobin. But since you normally are living at 97% or more, going from 97 to 100% doesn't really deliver that much more oxygen to the tissues. When we add hyperbarics, when we add pressure to the oxygen, what happens is not only do you 100% saturate your hemoglobin, but you also dissolve the oxygen into the plasma, or the liquid part of the blood, and you deliver tons more oxygen to the tissues. The tissues are just bathed in oxygen. So the way hyperbarics works then is the oxygen gets taken up by the cells, and the cells send the oxygen to the mitochondria. And the mitochondria is the powerhouse of our cells. The mitochondria does something called the Krebs cycle, which is this 8-step enzymatic process that produces ATP, or adenosine triphosphate, which is essentially fuel for our cells. The cells use the ATP for their metabolic processes. So the cells that are dead, the cells that have been killed from trauma or other diseases that patients come here with, those cells are gone. We can't bring back the dead. But the cells that have been damaged, the cells that aren't functioning properly, they're just kind of hanging out going like, what day is it? What am I supposed to be doing? Those are the cells that we can revive. We can get them doing again what they're supposed to be doing metabolically. And that is the main way that hyperbaric oxygen works. The other things it does is that it's a potent anti-inflammatory. So it relieves swelling and inflammation. And it relieves the swelling and inflammation that we can see grossly, like we have taken patients with facelifts who have just tremendous amount of swelling, so much so they can't even open their eyes. And after usually one treatment, the swelling is dramatically reduced. But it also reduces swelling and inflammation at the cellular level. So people with arthritis, colitis, any of the itises, we've had some success with thyroiditis, nephritis, they tend to improve because of that anti-inflammatory effect. The other thing it does is it helps with something called angioneogenesis. And angioneogenesis is the formation of new blood vessels into the tissue. So our bodies do this all the time. You go work out and you're building up your biceps muscle, and your body says, we need to get more blood to this biceps muscle. So it grows little blood vessels, little capillaries into the muscle to bring it more oxygen and nutrients. Hyperbarics will stimulate that process. So what happens is not only do you get more oxygen in your blood, but you get more ways for the oxygen to get to the tissues. Another thing hyperbarics does is it helps with the immune system. So it keeps your white cells, which are the infection-fighting cells, from sticking together. So they can go out and they can do their job chewing things up and getting rid of them. It helps to kill some viruses, it helps to kill some moles, it suppresses some bacteria. We use it at the hospital for necrotizing fasciitis, which is a flesh-eating germs that live well in a low oxygen environment. Basically, when we give them oxygen, we poison them, we suppress their growth. We use it for gas gangrene because it deactivates the toxin that causes the gas to be produced. It turns gas gangrene from about 100% fatal to 50%. The other thing that hyperbarics does is it has an effect on your stem cells. So stem cells are the umbilical cord cells. They're the cells that can become any cell in the body. Even as adults, the long bones of our body still make some stem cells and release some stem cells, and hyperbaric oxygen stimulates that process of producing and releasing stem cells. So the stem cells can go wherever they're needed. So if they're needed in the brain, they can become a nerve cell. If they're needed somewhere else in the body, they can become whatever cell our body needs them to be. So that's basically the main way of how hyperbarics works. So let's now talk a little bit about oxygen. So oxygen is like water. You can have too much of a good thing. You may be familiar with people sometimes drink a lot of water, they're sweating, they're not replacing their electrolytes, so they dilute out their electrolytes, and eventually they'll get weak, they could seize. The same thing happens with oxygen. Too much oxygen would eventually lead to a seizure. But there are a lot of signs that you're getting too much oxygen before you ever get to that point. So the first sign that you're getting too much oxygen is you'll notice a numbness and tingling around your lips or mouth. The second sign is you'll notice little muscle twitches. We call them fasciculations. It's like an eye twitch, but it can happen anywhere in the body where your muscles kind of start getting a little jumpy. And then the third sign is what's called carpopetospasm. And with that, your hands and feet cramp up in this really weird way. So if any of these things start to happen, we need you to let us know, hey, I'm not feeling right. If that starts to happen, all we do is we give you an air break. So we turn off your oxygen and give you air. If the symptoms go away, then great. We turn the oxygen back on, you finish your treatment. If the symptoms don't go away, then we'll work on taking you out. The thing about hyperbarics is you have to remember that it takes a good 5 minutes to get you out of the chamber safely. We don't want to damage your eardrums or have any problems like that. We are going to, before every treatment, check your vital signs. If you have a temperature, anything greater than 100.4, we won't put you in the chamber because fever does lower the seizure threshold. Most of our patients here really don't have any risk factors for this. I have actually never seen an oxygen toxicity seizure. We saw one alcohol withdrawal seizure, but never an oxygen toxicity seizure. So it's extremely rare, and we can easily prevent them. The bigger issue is the pressure, and the biggest issue with pressure is the ears. When we get you into the hyperbaric chamber, we're going to close the door and we're going to start pressurization. And it's going to your ears feel a lot like you're landing on an airplane. And then at the end of the treatment, when we depressurize, it's going to feel a lot like you're taking off. Landing is always harder on the ears than taking off, so we actually pressurize you slower, and we can usually depressurize the chamber a little bit quicker. So we're going to close the door, and you're going to start to feel the pressure build up in your ears. All you want to do is what you normally do on an airplane. So you want to open your mouth or yawn. You can swallow. Whatever you do on an airplane is what you'll do in the chamber. And you'll probably have to do it about a dozen times. Again, if you start feeling like the pressure is building up and you can't get your ears to pop, we want you to let us know that. Don't wait till the pressure is severe. Don't wait till you have pain. We do not ever want to have a ruptured eardrum. Just like you can have what the divers call ear squeeze, you can also get sinus squeeze. I actually have seen this one time at the hospital. The sinuses are air-filled cavities. We have 4 of them. We have a set here in our face, a set in our forehead, a set between our eyes, and another one that kind of runs behind our eyes on the side. So again, they're air-filled spaces. They're affected by compression and decompression. The guy at the hospital had been on some medication from his ENT, and he, for some reason, decided to stop it. Thought he didn't need it when he was doing hyperbarics, and so he was in the chamber, and then next thing you know, he's, hey, my face hurts. So we decompressed him and massaged his face to make it go away, and then got him back on his meds, and he treated. So again, very rare, but if you notice anything that just doesn't feel right, let us know. The eyes. So this is an issue that is very, very common. When we're born, the jelly in our eyes has a lot of water in it, and the eyes are very squishy. So we can compress people day after day, and the eyes will spring right back to the same shape and size. As we get older, certainly as you start getting to be my age, the eye jelly tends to dry out. It gets more rubbery. It's like you made Jell-O and didn't put enough water in it. So day after day of compression, the eyes may not go exactly back to the same shape and size. Even a fraction of a millimeter is going to change the focal point. That's the point where the rays come together to form an image. And so you may notice a little bit of a difference in your near vision or far vision. Most of the time, near vision gets better, far vision gets worse, but it can go the opposite way. If it happens, let us know so that we can document it in your chart. It is not a reason to stop hyperbarics. If it becomes severe, we might have you go see an eye doctor, but generally it doesn't. And most of the time, they say 98% of the time, if it does happen, your vision will go back to exactly the way it is now after you stop hyperbarics. 2 out of 100 people need a little bit of an adjustment, usually in their glasses. Teeth, you can have a cleaning, you can have a filling, you can have a tooth pulled. All of that stuff is fine. If something happens, some trauma or just something where they have to do some extensive dental work, anything that could put like an air bubble up under the gum, we skip hyperbarics for a day, let your body reabsorb that air. Your lungs. So with your lungs, you want to just forget about your breathing, just like you normally do. You're sitting here, you're not paying attention to it, you're gonna forget about your breathing. A lot of times we'll put on a movie or something and you just don't even think about it. So don't do breathing exercises, don't hyperventilate, you're gonna be saturated with oxygen. And then at the end of treatment, we don't want you to hold your breath. We want you to just breathe normally, forget about your breathing, and don't hold your breath at any time. For your tummy, just for comfort's sake, I always tell people the gas in there is going to get bigger as well. So you may not want to drink a big carbonated beverage. You may not want to add a can of beans or some other thing that you know, cabbage, onion soup, whatever, that you know gives you a lot of gas, because it's going to want to come out. You're going to feel bloated and you're in a confined space. So yeah, you may not want to do that. And that's pretty much it for pressure. A couple other little housekeeping things we should talk about. The big one is fire. So 100% oxygen doesn't cause a fire, but if there were a spark, we would all blow up and die. And that's not what I ever want to be on the news for. What we're going to have you do is we want you to come in as absolutely natural as possible. So no hairspray, no hair gels, no deodorant, no cologne, no makeup, no jewelry, absolutely nothing. We have 100% cotton scrubs. You're gonna pick a pair that's your size. We have them from extra small to extra large. You can mix and match tops and bottoms. And you're gonna go into the dressing room, take everything off, all your clothes completely naked, and then put the scrubs on. There are lockers in the dressing room where you can put all your stuff. Wipes in a bowl in the bathroom, so that if you accidentally forgot, you put some deodorant on or something that you're not supposed to have on. These wipes are safe to use to clean everything off with. Absolutely no petroleum products, no Vaseline or anything that's got a petroleum base to it. And if you're unsure, just ask us. There's a whole list of approved and unapproved things that can go into the hyperbaric chamber, so just let us know. A lot also depends on which chamber you're going in. If you're going into the multi-place chamber, that chamber is pressurized with air and you're going to get your oxygen through a hood. If you're going into the monoplace chamber, the whole entire chamber is pressurized with oxygen, so the risk of fire is higher. In that chamber, you're going to have a grounding strap, like your own personal lightning rod, so that if there were a spark, it would get grounded. And in that chamber, we're a little more cautious as to what can and can't go into the chamber with you. The big chamber, because it is pressurized with air, you can actually do something besides just sleep or meditate or watch a movie. In that chamber, you can bring in a book or a magazine and you can do some reading in there if you don't want to watch a movie. You cannot bring a ballpoint pen in there because it will squirt everywhere, but you can bring pencils, colored pencils, and crayons. And we have puzzle books, we have adult coloring books, we have different things that you can do while you're in there just to help pass the time. It just helps to make it go a little easier. The other thing to know is before you go into the chamber, there's a bathroom right there by the dressing room. What I recommend is that before you go into the chamber, make sure that you eat and pee. Everybody's blood sugar is going to drop some when they're in the chamber because sugar is going into that Krebs cycle with the oxygen to make energy. In most of us, it's not going to drop that significantly. If you're a diabetic, certain medications like insulin and even some of the oral ones, we have to make sure that your blood sugar is 120 before we put you in. But for most people, it's just going to make you hungry. So if you go into the chamber hungry, you're going to be sitting in there starving, like, when is this going to end? Get me out of here. So we want it to be pleasant, so just eat something. It doesn't have to be a 7-course meal, but you want to eat something. You also want to pee before you go in there, because hyperbarics does increase perfusion to the kidneys. A lot of people have to pee when they get out. And so again, you don't want to be sitting in there with your legs crossed, just going like, when is this going to end? You want it to be a relaxing and a good experience for you. With both chambers, it doesn't matter which one you go into, they work exactly the same. We have a 4-person chamber here, multi-place chamber here. Duke, for instance, has a 16-person. We have a monoplace chamber here. It's a peri chamber, which is the same chambers that get used at Sentara Hospital. So there's pros and cons to both, and a lot of it sometimes is personal preference. We used to only have the big chamber, the multi-place chamber, but we treat a lot of spinal cord patients and things like that, and it was not very dignified to have to keep getting them like on the floor in a blanket and dragging them in and out of the chamber, so we were able to get the monoplace chamber. Typically, the monoplace chamber gets used for special cases, people with spinal cord injuries, people who have other mobility issues, sometimes people who need a different pressure or length of time. Most of what we treat at the hospital and here, we treat at what's known as 2 ATA, or 2 atmospheres absolute. Sea level is considered 1 atmosphere absolute, and there's 33.3 feet of seawater equivalent between 1 and 2. So most things respond very well at 2 atmospheres absolute. A lot of what we treat here is brain and neurologic issues, and they're even more sensitive to oxygen under pressure. There's really no reason to go any deeper than 2. There are certain cases, though, where we go deeper. Somebody with an infection in their bones called osteomyelitis, we treat them at 2.5. Somebody with what we call late effects of radiation, where they, let's say, had cancer and they had exposure to radiation and it damaged their tissues really bad. Because of that severe damage, we treat them at 2.5. Divers and carbon monoxide poisoning, cyanide poisoning, we actually start at 3 for a short time and then bring back up. So people that need a special amount of time or a special depth will usually use the monoplace chamber for them. For most people, the chamber that you see behind me, the multi-place chamber, is ideal.